When we're talking about chronic illness, we're typically thinking about things like fatigue and joint pain, muscle pain, brain fog, other types of cognitive impairment, random neurological symptoms, really, life impacting, life altering types of symptoms. And they're all really, really important to talk about, of course. But one of the things that has come up with quite a few of my patients over the years, I would say well over a couple hundred patients of the thousands that I've worked with over the years, um, one that's come up that's not impactful from like a day-to-day functioning perspective, but that can be very impactful day-to-day nonetheless, is hair loss or hair thinning. And some of my patients have of these couple hundred or so patients with hair loss issues, it can be really, really challenging and disconcerting. Now, with the patients I'm referring to, they've all been female patients. I have had many male patients over the years with hair loss, and in most of those cases, it's been male pattern, and that's kind of a totally different kettle of fish, so to speak. But in terms of hair thinning or hair loss in female patients, in my experience, it's been something that's been very impactful for them. And so there are some things that I found to be helpful in that regard. Now, it's really important, and as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only, and please don't make any healthcare decisions for yourself without first discussing that with your healthcare provider. But beyond that, I have found that, or rather, the first step, of course, is to make sure there isn't some underlying organic issue that's contributing to the hair loss that's maybe more serious, like say unaddressed hypothyroidism, for example, or if there was, some severe, malabsorption, malnutrition thing going on, and the patient's wasting away and they happen to be losing hair as well, like things like that. We certainly want to make sure that there's not like an iron deficiency anemia. Those types of kind of basic things, assuming that those have been ruled out, and yet the patient's still losing hair, their hair is thinning, what can be helpful. Certain things have, in my experience, really not been helpful very often. It's been incredibly rare that I've seen collagen as a supplement help in those cases, and it's been incredibly rare that I've seen biotin help in those cases. And I really haven't often prescribed those things for hair loss in my practice career, but patients who have hair loss or hair thinning, they oftentimes come in on those supplements because they're just commonly recommended, or I don't know if that's what search engines say on the internet or whatever it happens to be, but it's reasonable to work with them. Those are things that are important for hair integrity, but I haven't really seen them lead to clinically meaningful impacts in terms of things improving. What I have seen make a big difference is working with a good multi-mineral at an appropriate dosage. So there's a certain product that I use in my practice on a regular basis for this in this regard. There's been a few different products I've used over time. There's one in particular that I use now, and it's got nice, robust dosages of various minerals. So, if you're dealing with hair loss, hair thinning, you could consider talking to your clinician about working with a nice, robust dose multi-mineral and see how well that works, and see what your clinician's thoughts are about that. With taking the minerals to help with hair integrity, in my experience, it's something that will oftentimes take at least a couple of months to really be able to see a significant difference. Within the first month, it's not uncommon that patients will say, yeah, I think I'm not losing as much hair, but actually noticing it growing back in a meaningful way, or like, oh, my hair has more fullness to it. It's usually around the 2 to 3 month mark that patients will start to report that. And sometimes they need to be on these minerals for quite a long time. In terms of why they need these minerals, I think in some cases it's maybe a malabsorption thing from their chronic SIBO or LIBO or yeast overgrowth or whatnot, or in other cases, I think it may be because their bodies are just burning through these mineral cofactors, trying to keep their immune systems afloat when they're dealing with chronic infections, or they're burning through a lot of these mineral cofactors because they're trying to detoxify their heavy metals or mold toxins or what have you. So I think in some of the folks suffering from chronic illness, it's just adding insult to injury when it's like, man, I'm feeling so rough and run down, and my hair is thinning or falling out to boot. So I hope this information was useful. If you have any questions about this topic or anything else, please post in the comment section below, and I will do my best to answer as soon as I can. Also, if you haven't already signed up for my mailing list, I'm just thinking about my mailing list because I just finished sending out a newsletter. Please consider subscribing to that. I post updates about things that are happening, around my thought processes, and just different initiatives that I might be working with. Live Q&A sessions, which we're planning to book another or set up another one of those fairly soon. And so if you haven't already signed up for my mailing list, please consider doing so. If you're watching this video on Instagram, please go to my bio, and in my link tree, there's a link to sign up for the mailing list. And if you're watching this on YouTube or Facebook, then I have the link in the comment section below. I will leave it there for now.